This is Agnes, everyone. Here, welcome. Yes. Well, welcome, Agnes.
Thank you.
You have been quite popular over the last couple of years.
Yes.
Oh my gosh, I think you are the epitome of what hardworking looks like in nursing. Especially when you're working under such extraneous circumstances. We are so proud of you. We are proud of you as Ugandans. We are so proud of you as nurses. And really, we are proud of you as fellow human beings, that the work you do makes such a difference. So congratulations.
What keeps me going? Because I know nursing is a calling. We are called to serve, but when we put money first or we put a good life first, I think we shall not be able to serve the patients. And I feel fine if I see healthy mothers, protected children, patients getting better. It makes me happy, and I feel the services I'm providing are doing something. At least there's an impact in the community. My name is Nambozo Agnes. I would like to thank the American Nurses Foundation in conjunction with Nurse to Nurse Global Initiative for this wonderful and prestigious award. Thank you so much. It means a lot to me. Thank you very much.
Hey! This is Agnes, everyone. Here, welcome. Yes, we can stand right here and take a picture. Come closer. Or maybe we can leave it right now. How is everyone? It's good? All right. Awesome. Welcome. Take a deep breath. She looks nervous. You seem nervous. Please, welcome. Welcome, welcome. This is your seat right here. We can have you there. Hello, my name is Dr. Schola Matovu, and I'm the Executive Director of Nurse to Nurse Global Initiative. And today we are speaking with Ms. Agnes Nambozo. Agnes Nambozo is a courageous Ugandan nurse, bringing life-saving care to some of the most remote mountain communities in eastern Uganda. To reach families cut off by geography, she regularly climbs a dangerous 1,000-foot wooden ladder carved in a steep cliff, a height that is too risky for children or mothers carrying babies, and they seek to attempt. And at the top, Agnes delivers essential nursing care, health education, and hope to communities that would otherwise have no access to health care. Her extraordinary dedication has earned her international recognition. For example, in 2024, when Bill Gates named her a hero in the field. Today, Agnes is being honored by the American Nurses Association with the 2026 ANF Health Equity Global Impact Award, which recognizes nurses advancing health equity and transforming lives worldwide. As Nurse to Nurse Global Initiative, we are honored to join ANF in celebrating Agnes's courage, passion, and global impact through nursing. Well, welcome, Agnes.
Thank you.
You have been quite popular over the last couple of years.
Yes.
Oh my gosh, I think you are the epitome of what hardworking looks like in nursing, especially when you're working under such extraneous circumstances. We are so proud of you. We are proud of you as Ugandans. We are so proud of you as nurses. And really, we are proud of you as fellow human beings, that the work you do makes such a difference. So congratulations.
Thank you.
Yes. So let's start from the beginning. We want to hear a little bit about you. For example, tell us a little bit about nursing. Why nursing? What really inspired you to become a nurse?
What inspired me to become a nurse? When I was growing up, I used to admire nurses, first of all. I used to admire their dressings, their smartness. So as I was growing up, I picked it. And when I reached senior 4, I remember telling my mother I wanted to either to go for police, for army, or become a nurse.
Right.
So my mom told me, no, you should not go for army. You must maybe become a nurse.
Yes.
So at least the two, at least among the two, I became one. Yeah.
Wow. And we are glad you made the decision to become a nurse.
Yes.
And is there any childhood memories, any child experiences, any aspirations you had as a little girl, maybe in school, that you think kind of geared you towards nursing per se?
Yeah. Okay. When after doing my senior 4, I didn't have tuition to further me in my studies. So that's when I picked, first of all, I first went for a nursery teaching course, which I completed 2 years, and I started teaching. But since it wasn't my calling, I told my mom, no, for me, I wanted to become a nurse.
Yes.
Why can't you look all ways and I become one? So they tried and they made me join nursing. But during that period, I could see people suffer so much, reaching hard to reach communities, especially pregnant mothers and children. So I was like, if I become one, I have also to extend my hand and help them, give them comfort, give them care, and be part of them.
Wow.
Yeah.
That's quite admirable. And I think as you say that, I think about the meaning that we carry, in terms of the decisions we make to choose careers, and the meaning that you saw the need to change something or to contribute to some good within your community kind of inspired you even more to get into the profession. That is quite, admirable. And so tell us about how you got to, how your nursing education was, and, your journey to becoming one after this grandiose dream of what you thought to be a nurse. So how did you fare on in terms of your education experience?
Okay, in my education experience, as I've said, after sitting my senior 4, my family is not well off, so I failed to go to senior 6. So that's when my parents decided to take me to a certain institute to do childhood education. So after childhood education, I didn't feel a calling, as I told you. So my uncle told me, no, we can try, and she becomes what she wants. So after that, I was taken to school. I did my certificate in comprehensive nursing at Nyenga School of Nursing. After serving for some years, then I joined Islamic University in Uganda. I did my diploma. And currently, I'm pursuing a Bachelor's of Nursing.
Yay!
At Ubstema University.
Congratulations on that.
Thank you.
I think the more you advance your education, the more you widen your knowledge, and even the bigger contribution that you get to make in your day-to-day work life, and even your own personal life, I'm sure.
Yeah.
Very impressive. So tell me about a typical day in your life when you go to work. Walk me through your day, usually, how that goes.
A typical day begins early, and it's often unpredictable. I attend to patients in OPD.
And what does that stand for?
Outpatient department.
Yes.
And the inpatient department, immunization. And sometimes I walk long distance for an outreach. Yes, I go for outreaches very far because I walk a long distance. But anyway, every new day comes with its challenges, but despite the challenges, there is also an opportunity of saving life and giving health education and preventing illness as well.
Absolutely. How far is it from your home, the distance that you have to walk towards work? How far is that estimated distance?
I'm not very sure because it's not a stretch.
Yeah, right, right. Wow.
It's not a stretch, but it takes me hours. Because
To walk from home to school? From your home to the workplace? How many hours does it take?
From home to the health facility, it takes me like 1.5 hours. Then from the health facility, if I'm going for an outreach, it also takes me like 2 hours because of the poor roads.
Wow.
And climbing the ladders, like if I'm going for an outreach. So,
And how long does it take to climb from the bottom of the cliff all the way to the top of where you...
taking care of yourself and the steps that you have to take climbing, it can take you like 1 hour to 45 minutes.
What?
Yes, because you have to take steps slowly. It is slippery. Some steps are not there, so you have to be careful as you're climbing.
Oh my gosh. It takes 1 hour
Yeah.
to get from the bottom of one of the ladders all the way to the top. So 1 hour from home to the bottom of the stairs and all the way another hour to get to the top? I can't even imagine that. And how many days a week do you work?
I work 5 days a week.
So you get to make that journey 5 times a week.
Like going for this other usual work, like outpatient, static immunization, it is from Monday to Friday. But going for outreaches, sometimes we have scheduled like once or twice a month.
I see.
Yeah, but if it is, maybe if there is an outbreak, we can go there like 5 days a week.
Wow. So the community that you take care of, everyone within that community lives on top of that. It's not a mountain, right? It's just a...
Yeah.
What would you describe it as?
It's a top.
It's a hill?
Yeah, after climbing, then up it's a slope.
It's a village.
Yeah.
Up there.
Yeah.
So everyone you take care of is on top of that village. On top of that cliff.
Okay, that parish specifically, it is divided in two. Yeah, the lower and the upper. It's one parish. Yeah, so we serve the upper people and the
lower
people.
level.
Yeah.
So you get at times, sometimes some days of the week you get to work at the bottom.
Yeah.
And other times you have to climb up the hill.
Yes, like for an outreach, we go there 2 days. We first immunize down, that's the lower belt. Then we immunize up, that's all.
My goodness, that is amazing. That is amazing to think that that's your work day. Every day. I think it makes me appreciate my work where I don't have to go up, the cliff to be able to do my job. But that is really very inspiring, and we truly appreciate you for that. So my next question is there one specific experience in your work life, in your work environment, that is most memorable, whether in a good way or a challenging way, that you can share?
Okay, there is this one day. I was still working, but not this specific health facility. It was a health center too, where I was heading. I was in charge. And I remember I was 8 months pregnant. And there are some small ladders also to reach that facility. So that day it had rained heavily. So as I was climbing, I was sloping down. Almost like 2 steps to complete the ladders, I fell and rolled, and I was alone, like no one could help me. But I was safe. I didn't sustain any injury. I was fine. I went home until I gave birth like that. So those are some of the challenges. And when it rains, those ladders are so slippery. Again, when it is dry season, there's a lot of dust.
Again, I'm trying to wrap my mind around that scenario. You're pregnant. How many months were you?
8.
You were 8 months pregnant, going up this ladder. where almost at the bottom where you slipped off slipped and fell, or was it somewhere in the middle?
No,
I mean,
like 2 steps, 3 steps to complete.
at the bottom. So it wasn't somewhere in, oh my God. You know, I mean, just to think about how dangerous that can be, not just for you, but for the baby. And what a day. And so does that happen for people as well, in terms of people who live on that hill, people who are older, people who are sick? Do they also have to access that same route to go up and down?
Yes, that's the only way. There is another route, but that route joins to Kapchora. Yeah, it takes people to Kapchora. So that's the only way and the easiest way to reach the nearby health facilities.
So they have to come down.
So the pregnant mothers, young children, and specifically up there, children start at school at 10 years so that they can be able to use those ladders.
Wow.
Yeah.
So it's mind-boggling to even think about that. So individuals who are older, 70s, 80s, have to use that ladder and come the up and down if they need services or need to be able to go different places?
Yeah, those who are able to.
Wow.
But there are those who are not able, like previously, there were some patients who had the TB, so and they were not able like to come and be picking their refills every time. So whenever we could go there, we would pick the drugs and they take to them. Then I've had scenarios where these mothers have testified how they have failed to push. Maybe they push when it is too late and the babies have died.
Yeah.
Yes.
So thinking about some of those health inequities that are created by, you know, the environment and the systems in which people live and are not able to access the resources and the care they need because of these physical challenges, first of all, you know, and the health challenges that they have as well.
Yeah.
And that's, I think, that underscores why it's important to have people like you who are willing to do that work, and why you need all the support that you can get so that you can be able to support these communities, right?
Yeah.
Remarkable, remarkable. Tell me about the one joyful experience in your work environment that you remember vividly.
The joyful experience is, okay, whenever we go to work, I've always got malnourished children. Yeah, those children who are unable, even like their mothers have left them, they are living with their grandmothers. So like we have got those children and we have provided for them. We have counseled their grandmothers. We have provided them with the Rutafa, and they are doing very fine.
Wow, that's good. So to see that gives you satisfaction in what you do.
Yeah, and at time I went there, I used to get children who have grown up without any immunization. Like when you try to check in their immunization cards, you find when they have not gotten all the vaccines, all the doses that are required. So when I went there, at least their cards are up to date. At least I feel okay.
You feel happy that everybody's getting the resources they need.
Yes.
That would make me happy as well. So good for you. So what keeps you going? What keeps you going back every day in spite of all these challenges that you may experience?
Okay, what keeps me going? Because I know nursing is a calling.
Yes.
And as Agnes, I think it was part of my life, becoming a nurse. I admired becoming a nurse. And I feel fine if I see healthy mothers, protected children, patients getting better. It makes me happy. It makes me happy, and I feel the services I'm providing are doing something. At least there's an impact in the community.
You feel the impact that you're contributing. That is great, because I think even being in a work environment that has all the resources there is for you to do your job, if you don't feel like you have an impact, it does not make a lot of difference, you know. And so it's good to know that you have the satisfaction knowing that you're making a difference. So I would like to conclude our exchange here by asking you about what message that you may have for the world. What, if there is something that you want to leave this world with as a message, what would that be? Whether it's to the community you serve, to the world in general, our world here in Uganda, or our world as a global community, what would be your message?
Okay, my message to the world or here in Uganda is the world should know that I am a dedicated nurse who believes in service, and I want to serve those unseen and undeserved communities. Yes, that's what I believe I should do as a nurse. Okay, despite all those challenges that we go through, I feel these patients need us.
Absolutely.
Yeah, so we have to reach them.
Absolutely. And I always say that, especially when I give these empowerment talks that I do in several universities and different settings or clinical settings. You know, when I speak to most of the Ugandan nurses, they say, well, doctor, you're lucky because you went to America and studied. You know, you have better working conditions. But we are stuck here. What can you say to a nurse like that who says that?
For me, okay, it depends on how people think about, because for me, okay, I've never thought of looking for, I don't know, should I say it, green pastures, or what for me I feel is that in you, how do you feel for that patient? Yes, we are called to serve. I think that is the major thing. Yeah, but when we put money first, or we put good life first, I think we shall not be able to serve the patients.
What a selfless attitude that you have. And I think that's why you are recognized now. That's why you are receiving this attention from the world that has just started to know about the work that you do, because you follow your passion and you lead with that core value that you hold of service, from what I hear you say. And like I said, you make us so proud to be called nurses. And I'm extremely excited that I met you and we got to exchange. And most of all, we are so grateful to join ANF in celebrating you, especially with this beautiful award. And so thank you for talking to us, and we're excited.
Okay.
Thank you, American Nurses Association, for recognizing this worthy nurse who is changing the world. Really the definition, the epitome of hardworking, of nursing leadership, that goes beyond any kind of constraints, to lead with the heart and to lead with compassion. So we thank you so much for recognizing Nurse Agnes, and for allowing us as Nurse to Nurse Global Initiative to be a part of this celebration. Thank you.
So on behalf of the American Nurses Association, we are so proud to present you with the inaugural American Nurses Foundation Health Equity Global Impact Award. Your passion, your tenacity, your fearless service remind us that nurses will always rise, no matter the terrain. Agnes, thank you, thank you, thank you.
And congratulations.
To actually, one more thing I want to share with you, we are going to give you a check for $1,000.
Thank you so much.